Good afternoon, I am Dr. Dinesh Balaji. Today we are going to discuss briefly about anorectal malformation. We are going to talk about the embryology of anorectal malformation, classification, various types of it, associated anomalies, what they usually present with, the presentation of each and every ARM, how we evaluate each and every case, and then management according to the type of the anorectal malformation. So to introduce you about it is basically it is an absent anal orifice. It is either completely absent or fistula like opening is present in a different location, not in the normal location. The most common anomaly in females is rectovestibular fistula, we call it RVF, rectovestibular fistula. It is different from rectovaginal fistula, which is a different variety. So the most common in females is rectovestibular fistula. The most common anomaly in males is rectourethral fistula, that is the rectum opens into the urethra. So to talk about embryology, this is the common so when a child develops, there is usually a common cloacal opening, a common cloaca for both the hindgut, the gut exit, and the urinary tract. So they both open into a common channel called cloaca when the child develops. This is called the cloacal plate. So as the child develops, something called the rectourethral plate divides the urinary tract from the rectum from the top down. That is, it invaginates from the sides and from the top also. So once the septum completely reaches the cloacal membrane, at that point of time the cloacal membrane completely disintegrates and forms two separate openings. The separate opening for the urethra and separate opening for the rectum. In females, usually the vagina and the uterus occupies this place in females. That is why the classification is different for males and females. So as the child later develops, the perineal body grows in size, completely separates the urinary system and the rectal body. So when the rectourethral plate disintegrates before it reaches the cloacal membrane, the various forms of anorectal malformation result as a result of the rectourethral plate. So how do we classify anorectal malformation? So this is the latest classification based on Krickenbeck. This is called the Krickenbeck International Classification. Here broadly classified into major and minor regional variants. So major, the most common anomalies are listed here, and the regional or rare variants are listed separately. So perineal or cutaneous fistula is common for both males and females. That is, a fistulous opening not in the normal anal region opens up into the perineum. That is called perineal or cutaneous fistula. Rectourethral fistula is where the rectum opens into the urethra through a small fistula. This is seen only in males, not in females. The types are bulbar urethra or prosthetic urethra. So it opens up into either the bulbar urethra or the prosthetic urethra. Based upon the location of the fistula, it is divided into bulbar and prosthetic. Rectovesical fistula is seen both in males and females. The bladder opens directly into the bladder. The rectum opens into the bladder. It is a high variant of anorectal malformation. Again, vestibular fistula, as we have discussed, it is seen only in females. The rectum opens into the vestibule, that is an opening outside the vaginal opening but inside the labia, between the labia but outside the vaginal opening. We will discuss about that also. That is called rectovestibular fistula. It is seen only in females. Cloaca again is seen only in females, where all the three openings, there is only a single perineal opening seen between the labia. The single opening houses both the urinary system, the exit for the vagina, and the exit for the rectum. That is, all the three openings will be seen in a single hole in the perineum. That is called cloaca. ARM without fistula. It is seen both in males and females. That is, the rectum ends in a blind pouch and it stays inside without any fistula. Anal stenosis again is seen both in males and females. Rare variants include pouch colon, where the colon, various parts of the colon, that is about variable distance of the colon, is transformed into a pouch-like structure, and it opens into the urinary system or into the vagina and uterus in females. Rectal atresia or rectal stenosis, where the atresia of the rectum results, but the anus will be patent in this child. The anus will be patent, there will be an atresia of the rectum, and the proximal sigmoid and the proximal colon will be normal. Only a portion of the rectum will be atretic. Rectovaginal fistula is seen only in females, and the rectum opens directly into the vagina, not into the vestibule. It is a rare variant. It is quite rare. H-type fistula is mostly it is acquired. There is a fistulous communication between the rectum and the anteriorly placed vagina in females. That is called a H fistula. Right. So how do these children present? Usually they present with this child, as you can see, it is a neonate in lithotomy position. As you can see, there is a small meconium pearl-like structure. The normal anal opening, this is the tip of the sacrum, and the coccyx can be seen here. This is the end of the scrotum. Usually it is located between the, if you divide this area into 3, it is usually located between the anterior 2/3 and the posterior 1/3. It should be somewhere around here. But instead of a normal opening, there is something like a fistulous opening in the anterior aspect. How do you differentiate between a fistula and the anus? Usually the anus is surrounded by anal corrugations and the muscular structure. A fistula does not contain all those. It is only a small opening, epithelium covered small opening. Okay, so this is a perineal fistula in a male child. This child has been passing meconium through the urine. There is no anal opening here. So most probably it is a high fistula. The child, it is called as meconuria. That is, they pass meconium through the urine, through a fistula into the either the prostatic urethra or the bladder. Most commonly prostatic urethra. So the meconium mixes into the prostatic urethra and comes along with the urine. So this is a high variant of anorectal malformation. So this is a rectovestibular fistula. As you can see, the labia is here. Labia is opening here. This is a normal anal opening. This is completely there is no opening here. Here, as you can see, there is a small opening here. That is the fistulous communication into the vestibule. This is called the vestibule. This is the vaginal opening. This is the urethra. Okay, so it opens into the vestibule. That is called rectovestibular fistula. This is the most common anomaly in females. This is a low variant. So what do they usually present with? It is a part of Vactral H, very prominent acronym in pediatric surgery. It includes vertebral anomalies, anorectal malformation, part of it, cardiac anomalies like ventricular septal defects and atrial septal defects, tracheoesophageal fistula, renal anomalies, all the renal anomalies encompassing, including horseshoe kidney, renal ectopia, renal vesiculated reflux, everything comes under it. Limb anomalies and hydrocephalus. It is called Vactral H.